So hello friends, and this is a part 2 of the gram-negative bacilli. So first start with the Brucella. Okay, so here you want to remember the four species. One, it is in Brucella melitensis, which is usually affect the sheep, goat, and the camel. There is Brucella abortus, usually affects the cattle, and suis is for pig, and for canis is for a dog. Okay, so coming for the mode of transmission. So it usually get affected only by the ingestion of the milk or the dairy product or any contact with an infected animal tissue. And also classical triad here is fever with night sweat, arthralgia, and there will be hepatosplenomegaly. So there's a specific term that is called as a Malta fever or the Mediterranean fever. And the important gold standard test here, it is a standard agglutination test. Okay, so next it is a diagnosis. Usually in the animals is done by milk ring test, rose bengal cord test, and the agglutination test. So here the treatment is for adult, you will be giving a streptomycin plus doxycycline. Actually that is a regime, but WHO regimen has been formulated as rifampin and the doxycycline. Okay, so coming for Yersinia pestis. So here you know there's a three. So first here what is a vector? It is a rat flea, and Xenopsila chiopis, it is for the North India, and for Astia it is in the South India. And the specific strain called as a Vason strain, it shows a bipolar safety pin appearance, and it also shows a stalactite growth on the nutrient broth or the fritri appearance. There is another fritri appearance seen in the Bacillus anthrax. So coming for the plague, it usually causes three types of plague. One is a bubonic, pneumonic, and septicemic. So here bubonic and septicemic, the incubation period is for 7 days, whereas pneumonic it is for 1 to 3 days. So drug of choice, it is in streptomycin, and here infectious is a pneumonic plague. So coming for the Helicobacter and Campylobacter, just I have put in as a tabular column. See, both are gram-negative bacilli. Helicobacter, it is in seagull shaped. Here it is in gull-wing shaped. Here it is in motile by unipolar flagellum, and here it is in darting motility, and it has a polar flagellum. For both it is in scirrhous medium. So and for diseases caused by H. pylori, it is an acute gastritis, peptic ulcer disease, chronic atrophic gastritis, autoimmune gastritis, and pernicious anemia. And in acute gastritis antrum, it is a most common site. Whereas here in Campylobacter, it usually causes an inflammatory diarrhea. So sorry for the spelling mistake, it is an inflammatory diarrhea. So next, what is about the investigations or non-invasive test? You will be using an urea breath test. Okay, so in that the non-reactive radio-labeled carbon with an urea will be getting, you will be consuming it. What happens is, if the organism is present, it will be releasing an urease enzyme. So what happened that the radio labeled carbon atom, what it will be releasing an urea. So the amount of urea plus the carbon dioxide. So here the non-invasive test is an urea breath test, and invasive test is an antrum biopsy. The antrum biopsy, it is usually and then we'll be going for the Vason strain or the Warthin-Starry strain. Okay, so here is an Warthin-Starry strain, whereas Yersinia pestis, it is a Vason strain. So here the rickettsia. Okay, so for rickettsia, just remember this tabular column, it's more than enough. So rickettsia provosaki causes an epidemic typhus. The vector, it is a louse, and rash will be all over the body except in the palms and the soles, and OX19 will be positive. So for epidemic and endemic, the OX19. Okay, whereas for tick-borne, it is an OX19 and OX2 will be positive. Okay, whereas for acari, it is a negative, and Ornithias, that is scrub typhus, it is an OXK. Okay, so now how you can remember this, like LET, L-E-T. Okay, so you can remember like louse, epidemic, typhus. Here fen, flea, F-E-N, endemic. Okay, F for flea, E-N for endemic, fen. So here Provosaki usually causes epidemic typhus, typhi causes an endemic typhus, rickettsia R for R, remember. Rocky Mountain spotted fever, Conori causes an Indian tick typhus, Acari causes an rickettsial pox. Okay, so here just remember these two are tick borne, whereas acari it is a mite borne. So coming for the rashes, so here it will be present all over the body except palms and soles, and palms and soles present in the rickettsia, and typhi it is usually trunk and then followed by extremities will be there. So coming for scrub typhus, so it is caused by Orantia susugamushi and it is transmitted by mite, that to the larval stage of the mite, and it will be presenting with an macular papular rashes, eschar and the lymph nodes. So next we will enter into the spirochetes. There are three species, Treponema, Borrelia and the Leptospira. Okay. So first we will deal with primary syphilis. So primary syphilis usually presents with a single painless or the indurated ulcer, but here there will be a regional lymphadenopathy, that is an inguinal lymphadenopathy. Whereas secondary syphilis, it is a highly infectious stage. It also presents with generalized lymphadenopathy, and then there will be a condylomata lata will be there. So tertiary syphilis presents with cardiovascular syphilis, that is most commonly seen in the ascending aorta, and also presents with aortic regurgitation. And neurosyphilis will be present with general paralysis of insane, tabes dorsalis and meningovascular syphilis. You know, a famous triad of our congenital syphilis is Hutchinson triad, that is in Hutchinson teeth, mulberry molar and saddle nose. So coming for the test, it is the most sensitive test, it is in fluorescent treponemal antibody absorption test. Specific test is treponema pallidum heme agglutination test, and if the option TPA also, but if the option have given TPHA, go for that. So investigation of choice for neurosyphilis is VDRL, and for congenital syphilis it is an IgM, fluorescent treponemal antibody absorption test. So coming for the Borrelia. Okay, so Borrelia recurrentis causes relapsing, that is an epidemic relapsing fever transmitted by louse, and Dottoni and Hermesii causes an endemic relapsing fever tick-borne, whereas Burdock-Ferry causes Lyme's disease, erythema migrans, and typical lymphocytic meningoradiculatus, that is an Banvard syndrome or the tick-borne, and Vincenti causes an Vincent angina, which usually affects with a direct contact.